Erin Riley, and I'm here today to do my Communication 101 presentation. These are my audience members. Most of us have come here today with the hopes of losing weight or being skinny, but what if I told you that being skinny doesn't always mean being healthy? Based on my own experiences of trying to achieve a happy and healthy lifestyle, I'm going to present to you information about unhealthy and healthy body fat. In our quest to develop healthy body weight, we will learn how taking care of our bodies by exercising regularly is more important than being skinny. During the minutes that follow, I will tell you how you should stop trying to be skinny and start trying to achieve healthy. Be prepared that changing habits requires time, energy, and effort. I will encourage you to stop being so concerned with your body image, and I will inform you that being healthy the right way will give you a longer and happier life. There are two different types of fat. First, you have the subconscious fat. This is the type of fat that is found underneath your skin. This is the type of fat that causes cellulite or dimpling, and this is the type of fat that causes somebody to look obese. Second, there's the visceral fat. This is the type of fat that is located in the abdomen and surrounds your vital organs. This fat can only be seen using an MRI machine, and you can actually appear to be thin but be extremely unhealthy because of this visceral fat that's inside your body. Many people think that a person with a lot of subconscious fat, which is the fat you see by looking at somebody, is unhealthy, but actually this can be untrue. People who are considered to be underweight have actually been reported as having as many as 7 liters of fat inside of them. An example of a person having a lot of subconscious fat would be a Japanese sumo wrestler. You would think that because our standards label them as obese, they would actually be unhealthy and have heart problems. This, in fact, is untrue. Studies have shown that they have little to no visceral fat, or the unhealthy fat that surrounds your vital organs. According to Professor Jimmy Bell, head of the Molecular Imaging Group at the Medical Research Council Center in Imperial College, sumo wrestlers have low cholesterol, low insulin resistance, and low levels of triglycerides. Their fat is stored underneath the skin or on the outside. This is an image of a body mass scan, and this green fat is the subconscious fat, or subcutaneous fat, that is on your skin, that makes you look fat, and the yellow parts on the inside is the visceral fat, which is a hidden fat that you can't see, and it's located around the abdomen, around in your stomach. So most people view healthy body weight by using a BMI, or body mass index, which relates to a person's height and weight. This method can be invalid and should not be used for many reasons. First of all, it ignores a person's waist size. Second, it doesn't take into account athletes who might have more muscles, which means they weigh more, which means they would be on the higher mass, and they would be considered obese by the body mass index. And third, the person who invented the BMI was a mathematician, not a physician, so he didn't know anything about body weight or health. Genetics ultimately affects where people store their fat. In a genetic analysis, which involved more than 75,000 people, a group of scientists who worked internationally found that lean people with a specific genetic variant were at a higher risk of developing type 2 diabetes and heart disease, even though they had lower body fat. Bell and his colleagues scanned men and women with the normal BMI scores, and he found that 45% of women and 60% of men had excess levels of internal fat. Professor Bell said, "Our work so far has shown that you can take 2 men of the same age with the same BMI and find one with 5 liters of fat inside of them and the other with 2 liters in fat inside of them." So for example, these 2 men were exactly the same height, exactly the same weight, same age, and they looked both to be healthy, but when they were given the scan, one man had 2 liters of fat, which is healthy, and the other man had 5 liters of fat around his organs, and those liters of fat were not visible to the naked eye. So how can we tell if we have a lot of this visceral fat? Unfortunately, the only way to accurately determine if you have this visceral fat is by using an imaging machine. So for normal people who don't have this luxury, by taking the circumference of your waist is a fair judgment of visceral fat. So if you have excess of belly fat, there's an 80% chance you might have this high visceral fat. So the next question, are we able to get rid of visceral fat? Yes. The only way you can get rid of it is not by eating healthy foods or cutting calories. The only way you can get rid of it, according to a study done at Duke University, is by exercising. Duke University researchers found that people who had less physical activity had a huge increase of visceral fat, while people who exercised more had a significant lower of visceral fat. They found that a brisk 30-minute walk 6 times a week can prevent the accumulation of this fat, but even more vigorous exercise can actually reverse the visceral fat. So the study done at Duke also showed that aerobic exercise is the best way to lose visceral fat, and that it burns 67 more calories than weight or resistance training. So as you can see, it's more important to be healthy than skinny. Learning how to exercise more and not being so concerned with skinny will ultimately give you a healthier and longer life. Appearing to be skinny on the outside does not always mean you're healthy. Do you want to live a long and healthy life like God intended us to? Start exercising and stop being so obsessed with losing weight.